Hi, I'm Jonathan Cohen, a clinical professor at NYU Langone Health, and it's my great pleasure tonight on behalf of the ASGE Value of Colonoscopy Task Force to interview my friend and colleague at NYU, Peter Liang, a assistant professor of medicine and a researcher in colorectal cancer, who has just published a great article on risk factors associated with early onset colorectal cancer in clinical gastroenterology that appeared November 2020. So, Peter, let's talk for a second about some of these other risk factors, besides family history, that you've been identifying, and how that might play into discussions with patients as to what screening to obtain. If the risk of finding an advanced adenoma or cancer is higher, does that, do you foresee that influencing the effectiveness of doing, going right to colonoscopy at that early age? What's your thoughts?
Yeah, I mean, I think you're saying with respect to some of the risk factors that we found.
Sure. If you have a person who is at who has a little bit of a higher risk factor, say has a grandparent with colon cancer and perhaps is African American, does that influence your discussion really in terms of you're 45, which screening modality to proceed with?
Yeah, so that's a really good question. I think, I'm someone who, obviously, I do the primary research. I'm really interested in the evidence, and I'm, definitely stand by. I'm really proud of what we, of our study. That said, it is a single study, and I think it's probably premature to just kind of risk stratify based on our study alone. And I think there's going to need to be additional studies to hopefully replicate that, and then figure out if there's a role to more formally kind of establish risk scores to risk stratify people by some of the risk factors that we found, or potentially other ones. So for right now, I don't think, I would, based on, say, a race ethnicity, I would, think more about telling individuals to screen with different modalities or start screening it earlier. So for now, I think I would treat everyone still the same, other than the things that we know about, like the family history and inflammatory bowel disease and such. But, hopefully, with more data, more time, we will be able to, figure out more nuanced ways to risk stratify people, and think about, is it better to, in terms of, resource utilization, do we need to do colonoscopy on everyone? Can we perhaps do flex sig? Can we perhaps, have different kind of algorithms for dealing with different people based on risk stratification?
That's very interesting. I think this is a little bit getting into a different topic, but it occurs to me that the information about risk factors, especially if it's borne out by prospective, further, studies to corroborate what you found, it might be very useful in reducing barriers to doing screening to pursue colon cancer, especially in groups that may be at higher risk. To say, hey, we have some of this evidence suggesting that there's a higher risk for early onset cancer. I know there's a lot of added public attention to early onset cancer in recent days, and I think that some of your data might be very useful in reducing obstacles and barriers to going ahead and going through screening. What do you think?
Yeah, absolutely. I think that certainly is the hope. I think with anything, in terms of research, ultimately what we want to do is to be able to spread the message, right? Tell everyone and tell the people who that research is hopefully going to impact and improve their lives, that this is, this is the most current evidence, and we think that, for your own health, you should perhaps screen earlier. Again, I think at this point, we're not kind of there yet in terms of having a changing the clinical management for specific types of people, because I think that's still a little bit premature. But certainly, once we accumulate more evidence and be able to put out, guidelines and things like that, then it's really upon all of us as clinicians who see patients, or public health professionals, to really disseminate that message and then implement it in our practices. I think I've all heard that even when guidelines come out, and guidelines, this is many years after the primary research. After guidelines come out, it takes many years for it to be implemented into practice, and that's often too slow. So I think you're right. I think there's certainly been a lot of attention on this condition recently, with the unfortunate passing of Chadwick Boseman and other folks, right, and a lot of other less famous folks who've been affected. But so I think we should use that momentum to learn more about this condition, and hopefully find the right strategies to combat it.
Well, I think your work is really and the ability of the Value of Colonoscopy campaign to get the word out about some of this is going to help in that regard. Peter, so what's next? What's the next area of research? What's next on your plate to pursue this?
Yeah, so I mean, with regard to early onset colorectal cancer, we're still doing a lot of other projects to looking at other data sets to figure out if there are, besides the things that we can find in the medical record, right? We think about these are people probably maybe have had some type of exposure when they're much younger, and that wouldn't you wouldn't find that in EPIC, right? But so looking at some data sets that have asked about exposures when individuals in their childhood, or even kind of around birth, related those types of things, to see if there are ways to risk stratify based on that. And then just in terms of other kind of questions, I'm also really interested in figuring out what's the kind of the optimal way to screen and surveil people for colorectal cancer screening, because obviously, as we've talked about, there's a bunch of different tests that we can do to long term, what is the optimal kind of screening and surveillance strategy? I think it's also a really kind of interesting problem to look into. So lots of different questions, but slowly trying to make progress in all of those.
Well, Peter, I really appreciate your taking the time this evening to talk with us about your great work, and I'm really glad that we have people like you on the case to push this important area further. So thanks so much, and I'll let you get back to work.
Well, thank you so much. It was a pleasure being here, and anytime. So thank you.
On behalf of the ASGE Value of Colonoscopy campaign, we thank you for spending time with Peter Yang of NYU Langone Health this evening, and we'll hope to see you soon.